The incidence of MPN in the background population is 6 to 9 per 100,000, and it's much less frequently experienced in women of reproductive age. However, there are a cohort of patients that we see for preconception planning and during pregnancy, and it's important that every hematologist has an understanding about MPN in pregnancy and works in collaboration with their obstetrician and midwifery group in order to provide best care for these patients. More recent data suggests whilst there is still an increased risk of miscarriage and complications due to placental dysfunction, including early delivery, babies that are small for gestational age, and occasionally stillbirth, that overall the live birth rate is very good. And some interesting data from EHA 2016 by Grieshammer also looked at following diagnosis in polycythemia vera outcome for pregnancy was improved, and as such this does suggest that the current treatment for MPN in pregnancy, which is becoming more consistent with more data being published, does lead to better outcomes. The management of every pregnancy is individualised, and hopefully prior to conception we can consider treatment options. In the main, we would offer all women aspirin throughout pregnancy to be continued, and in cases where we consider the pregnancy to be at increased risk of either maternal or fetal complication, we would be looking to consider introducing other treatment agents such as low molecular weight heparin and interferon. We tend to monitor these ladies with a 20-week scan, a uterine artery Doppler, and then serial growth scans, and the majority of our patients who progress through to the second and third trimester of pregnancy have a successful live birth. What we are seeing is still 23% of these babies are being born below the 10th centile, and there is an increased incidence still of premature delivery, and this still relates to placental dysfunction. So we have more work to define the best treatment to prevent this. In Europe, there are databases collecting details of pregnancy in MPN. Potential future studies may include looking at the placenta with MRI in pregnancy in MPN to learn more about how the placenta is functioning, and also the potential of whether we would be looking at trials with regards to randomising women to interferon or placebo in a lower risk cohort without prior poor pregnancy outcome.